You're preparing for retirement. You've worked hard for decades. You've planned, you've saved. You know you'll have to pay a monthly fee for your Medicare medical insurance. You've even heard the standard number from friends, maybe looked it up online. You've budgeted for it. But what if I told you that the bill that arrives in your mailbox could be 30%, 50%, or even double what your neighbor pays? What if that number was so high, it made you question your entire retirement budget? And the worst part, you wouldn't even know why. In this video, we are pulling back the curtain. We're not just going to explain what Medicare Part B is, we're going to expose the hidden mechanism within the system that determines whether you pay the standard price or a penalty that could follow you for the rest of your life. Let's get one thing clear. Medicare is not one single thing. It's a system with different parts, and people get them confused all the time. Think of it like this. If Medicare Part A is your insurance for your hospital bed, then Part B is your insurance for almost everything else in your day-to-day medical life. It's your key to the doctor's office. This is your medical insurance. It pays for doctors, it pays for tests, it pays for checkups. And let's get another thing straight right now. It is absolutely not free. You pay a monthly fee for it, called a premium, every single month. Now, you might hear that Part B is technically optional. And that's a dangerous word, because while you can technically decline it, if you do so without having other credible medical coverage, like from an employer you or your spouse are still actively working for, you will face a penalty. And it isn't a one-time fine. It's a late enrollment penalty that is added to your monthly premium permanently for the rest of your life. A choice that isn't really a choice at all, is it? So, what are you actually paying for? What does this monthly fee get you? Part B covers two main categories of services, and you need to understand both. First, it covers medically necessary services. These are the things you need to diagnose or treat a medical condition. This is what you think of when you think of health insurance. It's the visit to your primary care doctor when you feel sick. It's the appointment with a specialist for your heart or your joints. It's ambulance services. It's durable medical equipment, like walkers or wheelchairs. It's what you need, when you need it. Second, it covers preventive services. This is the care you get to prevent illness or detect it at an early stage, when treatment is most likely to work best. This includes things like your annual wellness visit, flu shots, cancer screenings, diabetes screenings. These are the things designed to keep you healthy in the first place. But here's a fundamental rule you need to burn into your memory. It's called the 80-20 rule. After you pay your small annual deductible, which is a set amount you pay out of pocket once per year, Part B generally pays 80% of the Medicare-approved amount for most covered services. The other 20%, that comes out of your pocket. And there is no yearly limit, no cap on that 20%. It might sound small, but 20% of a very large number is still a very large number. This single fact is one of the biggest financial risks for seniors on Medicare, and it leads directly into the next critical piece of the puzzle. The things you think are covered, but absolutely are not. And now, for the part of the conversation that comes as a nasty surprise to millions of new retirees. Part B is not, and was never intended to be, all-inclusive health insurance. It has massive gaping holes in its coverage, holes that can cost you thousands of dollars a year. Think about the three things that are almost guaranteed to be a part of aging: your teeth, your eyes, and your hearing. What about routine dental care? Cleanings, fillings, crowns, dentures? Not covered. That's all on you. What about vision? Your annual eye exam to get a new prescription for your glasses. The glasses themselves? Not covered. What about hearing aids? Devices that can cost thousands of dollars and are essential for quality of life? Not covered. And the biggest one of all? Prescription drugs. The daily medications you pick up from the pharmacy that keep you healthy? Not covered by Part B. That's what the entirely separate Part D is for, which comes with its own separate monthly premium. So you have these major expensive gaps in your coverage, and you're still paying that monthly premium for the services you do get. The logical question, the one everyone wants answered, is, how much is that premium? Every year, the government sets the standard monthly premium for Medicare Part B. For 2025, that standard premium is $174.70. For most of the 65 million Americans on Medicare, that is the number. It's the price of admission. This amount is usually deducted directly from your Social Security check before it even hits your bank account. It's a clean, simple transaction. You pay your $174.70 and you get your Part B medical coverage. For millions of people, this is the end of the story. It's a fixed cost they can plan their retirement around. But for a growing number of Americans, this is not the end of the story. It is a dangerous assumption, because that standard premium, it's only the price if your income falls below a certain line, a line that was drawn in the sand years ago. And if you stepped over it even once, the price you pay today could be dramatically different. And that brings us to the most important and the most misunderstood part of this entire system. It's the reason that bill in your mailbox could give you a heart attack. It's the reason you could be penalized for a successful career long after you've stopped working. The reason your bill can be so much higher has a name. It's a cryptic government acronym, of course. It's called IRMAA. That stands for the Income-Related Monthly Adjustment Amount. But let's call it what it really is, a success tax, a penalty for a good income hidden inside your Medicare premiums. Here's how this mechanism works, and it's a detail that trips up millions of people. To determine your monthly premium for this year, Medicare doesn't look at your income this year. They don't even look at last year. They look at your tax return from 2 years ago. Let that sink in. You're living in 2025. You're retired. Your income has dropped significantly. But the Social Security Administration, the agency that handles your Medicare billing, doesn't see the retired you. They are looking at a ghost. They are looking at your 2023 tax return, the you from 2 years ago. Were you still working full-time in 2023? Did you have a great year? Did you sell a piece of property? Did you sell stocks that resulted in a large capital gain? Did you convert a traditional IRA to a Roth IRA? Because if you did, that version of you, the ghost of your past financial success, is about to determine how much you pay for healthcare today. The government sets income thresholds. If your income from 2 years ago is below the first threshold, you pay the standard premium. But the moment you cross it, even by a single dollar, your premium jumps. For 2025, the first threshold for an individual is just over $103,000. If your modified adjusted gross income on your 2023 tax return was $103,000, you pay the standard premium. If it was $103,001, your monthly premium for Part B instantly increases by nearly $70 every single month. And it doesn't stop there. There are multiple income tiers, each one with a higher penalty. The next tier adds over $170 to your monthly premium. The one after that adds over $280. It continues up through 5 tiers, to the point where the highest earners pay almost $600 a month for the exact same Part B coverage that their neighbor gets for $174. And the final brutal twist? This success tax, this IRMAA adjustment, it doesn't just apply to your Part B premium. It is also added to your monthly premium for your Part D prescription drug plan. It's a double penalty. 1 look back in time, 2 hits to your wallet today. This is the Medicare secret that so many people discover too late. When the bill arrives and the damage is already done, they feel blindsided, angry, and trapped. But today, you are no longer in the dark. So let's bring this all together. Let's recap what we've learned. First, Part B is your essential insurance for doctors and outpatient services. It's your key to the healthcare system. Second, remember the 80-20 rule. Part B has no safety net, no out-of-pocket maximum. Your 20% share of costs is unlimited, and that is a massive financial risk that must be managed. And third, the price you pay for Part B is not the same for everyone. The ghost of your income from 2 years ago can come back to haunt you in the form of IRMAA, a success tax that can dramatically inflate your monthly premiums. So here is your homework, your first step to taking back control. Find your federal tax return from 2 years ago, not last year's, the one from 2 years prior. Look at the front page, at your modified adjusted gross income. That number holds the key to what you will pay this year. Is it over the first threshold? The second? Now you know. You can plan for it. You can budget for it. You can fight it, in certain circumstances, through a formal appeal process if you've had a life-changing event. But you cannot fight an enemy you cannot see. And now you see it. Have you been hit by IRMAA? Did you even know it existed before this video? Share your story in the comments below. You are not the only one going through this, and your experience can be a powerful warning to others who are just starting this journey. If this video opened your eyes, if it brought you clarity, If it helped you avoid the shock of a bill you didn't see coming, then you need to be here. This is what we do. We don't sell you insurance, we give you the truth. Subscribe to the Medicare Compass. We are your independent guide in a system that is designed to be confusing. Click that notification bell so you do not miss the next critical briefing. And if you know someone who is approaching age 65, sending them this video might be the most valuable financial advice you give them all year. Navigate with confidence. We'll see you in the next video.